Hello, Gary Crowley here with DoItYourselfJointPainRelief.com, and we're on step one of finger pain relief. And in step one, we're going to release the muscle attachment inflammation, if there is any. And for finger pain, there's kind of two kinds. Some people, when they say finger joint pain, are talking about their knuckles. And a lot of times if you've jammed your knuckle or injured your knuckle doing something, they heal, but they don't quite heal in a way where they can function fully. So the first thing we're going to do is make sure that we release these knuckles, especially if that's where it's painful for you, so that your finger can function. And basically, let's just assume this is where it hurts on this knuckle. And basically what you want to do is you want to feel around for tender tissue. And if it's tender on the sides, which it often is if you've injured this, you want to press on that, probably both sides at the same time, and make that joint function. And this can be actually pretty painful. All the stuff I do, I've jammed my knuckles doing everything from volleyball to martial arts or whatever. And when these need to be released, it is a little painful. You're pressing right on the bone with these tendons. But it's well worth it because you can release your own knuckle so it'll work. So you grab both sides. If it's tender there, you make the joint work as best you can. Then you might go to the top and maybe get your thumb in there a little bit, make that joint function. You might feel tension in here. You get your finger in there, and basically I'm either doing the press, hold, move, where I'm pressing and holding and moving that joint, or I'm doing the press, pull, release. You'll kind of feel in different areas you get better results with one versus the other. You know, if you happen to feel tension here, you stick your thumb in there, make that joint move, or do the press, pull, release there. Again, you got to play around. Side of the finger here, so where it's tender and where you feel the tension in the joint being restricted. So if you're trying to bend it this way and you feel like this is where it's tight and it's not allowing it, get your thumb in there, press, pull, release, or press, hold, move, press, hold, move. This will let go, but it can be a little painful. So that's step one. You want to find any tension or any tender tissue here. Step two is not step two, but part B of step one is we then want to release the palm of your hand. Sometimes people have pain in their finger, but it's actually coming from the palm of your hand being tight, because basically the tendons go up to your fingers and make your fingers move, and a lot of times it's coming from in here. So basically you want to feel whatever finger hurts. Let's stick with this one again. You want to make that finger move and feel the muscles that make that move. And a lot of times if you don't have that first kind of pain, that knuckle kind of pain, but general pain in your finger, you'll press here and you'll feel that tendon's tight, and you'll feel that it's tender. And again, press, hold, move, press, hold, move, press, hold, move. You want to feel the muscle you're pressing on moving a little bit as you move that finger. And as it gets less tender, you kind of test your finger, see if it starts feeling better. Or you can do press, pull, release. But again, you want to find the muscle that makes that finger do that by pressing on it. So we got the step 1A, release that knuckle and any tension or tender tissue around the knuckle. Step B, investigate, if it was this finger, investigate the muscles that make that work, and then either press, hold, move them, or press, pull, release. So that is step one of finger joint pain relief. Give it a shot, and I look forward to hearing how it goes. Thank you.